Hi everyone. Today our topic is data analysis by using AI in healthcare. AI can greatly enhance your data analysis skill to analyze for medical research data with any statistical software like SPSS, SAS and Python. Core component of AI in medical data interpretations. Artificial intelligence has transitioned from an experimental tool to a core component of medical data interpretation, significantly enhancing diagnostic accuracy and patient outcomes. Over 1500 AI enabled medical devices have received FDA clearance with approximately 873 algorithms approved in 2025 alone. These systems act as a digital colleagues, augmenting the expertise of healthcare professionals by identifying subtle patterns in complex datasets that might be invisible to the human eye. Medical imaging and diagnostics. AI has achieved remarkable milestones in radiology and pathology. For example, deep learning models can now detect lung nodules with 94% accuracy compared to 65% for human review alone, and identify signs of pancreatic cancer up to 18 months earlier than traditional methods. In radiology, AI powered triage systems automatically prioritize critical cases such as stroke or intracranial hemorrhages, significantly reducing the time between scan and life-saving treatment. Predictive analytics. AI engines analyze vast datasets including electronic health records, genomic profiles, and real-time vital signs to forecast adverse events before they occur. Key achievements include sepsis prediction system like Johns Hopkins TREWS can predict sepsis hours earlier than the standard methods, leading to a 20% reduction in mortality. Cardiac events. AI-driven ECG interpretation now identifies arrhythmias and at-risk individuals for arterial fibrillations even when their current heart rhythm appears normal. Precision and personalized medicine. AI is the forefront of personalized medicine 2.0, where it analyzes an individual's genetic makeup and real-time biometric to tailor specific treatment plans. In oncology, AI platforms match tumor genomic data with the most effective targeted therapies, reducing trial and error in chemotherapy selection. Remote monitoring and wearables. AI is increasingly used to interpret data from wearable devices on the fly, providing continuous monitoring for chronic conditions like diabetes and heart failure. These tools can detect early signs of patients' deteriorations, triggering proactive interventions that reduce hospital readmission by up to 50% in some cases. Achievements in trust and technology. In 2025 year marked a shift towards explainable AI which provides clinicians with transparent, evidence based rationalize for its recommendations, moving away from black box models. Furthermore, the adoption of federated learning allows for the training of robust AI models across multiple institutions without sharing sensitive raw patients' data. Maintaining strict privacy standards like HIPAA, while AI continues to revolutionize interpretations, human oversight remains essential for complex reasoning and the ethical delivery of care. Please subscribe and like our channel and press bell icon for more videos.